Hi, this is Dr. Sabrina Akrami. Thank you so much for watching my video today on palpitations. I am a board certified internal medicine and cardiovascular medicine physician, and this is a complaint I get pretty much on a daily basis, both from patients and family members, family friends. Palpitation seems to be a big concern with a lot of people and is very common. So I'm going to go ahead and talk about that today. If you do enjoy the video today, please give it a thumbs up and subscribe. And if you have interest in other topics, please leave a comment below to let me know what you guys would like to hear. So first of all, palpitations is basically a fluttering sensation, rapid heartbeat sensation, or skipping beat sensation that a lot of people complain of. And it can be associated with things like dizziness, chest pain, passing out, fatigue, and also associated with stress. So all of these things can contribute with palpitations, and sometimes people even complain that they feel this sensation going up into their throat or neck or shoulder or something like that as well. So there's a long list of things that can cause this, and a lot of times, to be honest, they don't even always know what the cause is, but they try and rule out the most dangerous things first and work their way down. And some of these things can be related to the heart, so I'm just going to touch briefly on that. So different things like stress or anxiety can absolutely cause it. Any type of stimulant, including amphetamines, so things like cocaine, obviously not very good. It's going to make your heart rate go faster. Smoking, alcohol use, caffeine, so that includes like chocolate, coffee, tea, soda. All of these things can make it worse. Sometimes I'll have asthmatics or COPD people who have lung issues that will be taking inhalers that can sometimes make their heart race as well, and that can happen absolutely. Oftentimes it can be related to your thyroid. So thyroid is a gland right in your throat, neck area. It gives off hormones to the whole body, including hormones that affect your heart that can make it speed up or have all sorts of issues as well. And during pregnancy, people can get palpitations. And of course, from the heart standpoint, something we call arrhythmias can do it as well. So irregular heart rhythms or extra heartbeats absolutely can do it. Basically, just a quick breakdown if you're curious. The heart is basically a big muscle. It's about the size of your fist. It's on the left side of your chest, and its job is to pump nutrients and blood to your whole body. It's composed of a couple different parts. Just a very simplified version. Again, it's made out of muscle, and it has little blood vessels in the heart. Those are the ones that when you hear people talk about getting clogged up with cholesterol, causing heart attack, those are the blood vessels. And inside your heart, everybody has 4 valves that open and close to let blood through, and then the heart pumps the blood out through the whole body, giving the body nourishment. But everyone's heart is born with a natural electrical system, and the electrical system of the heart signals the heart muscle when it's supposed to pump. So when they do an EKG of your heart, it's actually looking at the heart's electrical system. So it gives people a lot of information, including irregularities of your heart rhythm, sometimes signs of heart attack, and all sorts of different things. So it's a very basic screening test that's very helpful that your doctor may do in the office, or you might have at some sort of health screening or something like that. Things that you can do to check to see what these irregular heartbeats or palpitations are coming from, if you see your doctor, would be blood tests, to make sure you're not anemic, because definitely low blood count can make your heart pump harder, and then you could feel palpitations and stronger heart sensation. If your electrolytes are off a little bit, like including your magnesium or potassium, those things can aggravate it. Of course, if your thyroid hormone is off a little bit, that'll do it. Some other things are, we're going to recommend, of course, number 1, to avoid any type of those stimulants that we talked about. So the caffeine, alcohol, smoking, basically anything that's fun. Definitely can aggravate it, unfortunately. Just kidding, though. But one thing I do want to point out is that I do get lots and lots of young female patients that come to me either from referral from their doctor or for a second opinion or something like that. And they have been misdiagnosed as having anxiety or panic attacks This oftentimes can present very similar to heart irregularities or heart rhythm issues. And very oftentimes with young people with palpitations, it can be anxiety or panic attacks or stress. Absolutely can make your heart race faster. However, it's never a good idea to just assume that without doing some basic testing to make sure that the person doesn't have some underlying heart disease. So what I found many times is when that patient is in my office, I'll do the basic blood work and whatnot, and a very good test would be a heart monitor. So just like an EKG kind of, they put little stickers under your clothes, and they might have a little monitor that you can hide in your pocket under your clothing. We have a lot of different kinds of monitors. So some are 1 day, some are 2 week, some are 1 month, and then there's even ones that are longer that they could put under your skin in severe critical cases that they're not able to pick up the rhythm, but the person is having dangerous symptoms like blacking out twice a year, but not enough that they can catch it to see what's going on. So in those cases, it's just really important that they don't disregard people's palpitations as panic attack or anxiety until they rule out other things that could be dangerous or need to be treated before you can say that. So another thing that I might do is a lot of times if my patient says that the palpitations are significantly worse when they're doing activity or exercise, I might just put them on a treadmill in a safe environment, in a controlled environment, to see if we can elicit some of those palpitations. If I don't see anything on the monitor or on the EKG at the time, then I know it's not coming from the heart, so it's a little bit more reassuring. Palpitations are really common. Most people have occasional extra heartbeats, a little bit of can feel like just an occasional palpitation. Usually they'll notice it when they're taking in like extra coffee or something like that. But those people that are a little bit more dangerous, a little bit more worrisome, that I get worried about, are when they tell me that they had so much palpitations that they had to stop what they were doing, that they blacked out, that they had so much chest pain or they couldn't breathe, they ended up in the emergency room. Those are things that are a little bit more concerning. Also, if it's a young person and they told me they had sudden death and young family members, sudden or unknown, those are things that are a little bit more concerning, that makes me a little bit more aggressive to do more thorough workup to make sure that we're not missing any more dangerous life-threatening heart rhythm issues. So the treatment for palpitations are, of course, no surprise, to treat the underlying cause. So like we said before, avoid those things that trigger it, that stimulate it, avoid the stimulants, and also we can do medication depending on what type of rhythm issue is going on that we're picking up. We do have medications that can treat symptoms. Usually we reserve those for people who are very symptomatic, that they can't do their daily activities, for those benign or not dangerous heart rhythm issues. Oftentimes when young people find out that the palpitations are not dangerous or life-threatening, then they're okay with it and they do not want to be on medicine, which is understandable. But in some cases, some people can be born with an extra electrical pathway that gets triggered occasionally, and their heart just goes off into this fast heart rate, and it's very difficult to get out of. So in those cases, sometimes we'll usually start out with medications to see how they do, treat any of the underlying issues otherwise that we can, and then oftentimes, not oftentimes, but sometimes when people fail, like let's say, generally speaking, 2 heart medicines that can control it, but they're still very symptomatic, then we might refer them to a heart rhythm specialist or an electrophysiologist who specializes in doing a procedure where they go inside and find the problem area, and they'll either burn or freeze the problem area around it. It's a very good procedure. It works pretty well and very low side effects. However, of course, we try not to push people for procedures because no procedure is without any risk, and we always try to treat with medication and other things first before we put someone through that. So those are the main issues. Also, the other thing is if someone has a lot more dangerous risk factors, like for instance, they've had open heart surgery or coronary artery disease or heart attack in the past, they're more, or weakened heart muscle, we call it congestive heart failure. Those people also are more likely to have more dangerous heart rhythms. So again, we're a little bit more aggressive in treating it, and those are more worrisome. So that's just a quick synopsis of palpitations and, you know, what causes it and treatments for it. So I hope that was very helpful for you guys. If you guys have any questions, again, please just leave a comment below. And thank you for watching. Thank you for the support.